I'm Kath Evans, Community Nurse Lead in NHS England. Leading Change Adding Value is a framework for all nursing, midwifery and care staff, and it's a framework which all staff can use whatever their role and wherever they work. I'm particularly interested in this service as Community Nurse Lead to show the links between how acute care can be provided in people's own homes and how a community nursing service can support that. The at-home service in Guy's and St Thomas's is a hospital substitution service, and it's caring for people with quite acute complex illnesses in their own homes. We spoke to several staff in Guy's and St Thomas's as part of the hospital at home service.
The Guy's and St Thomas's at home service is a hospital substitution, so it's providing acute care that would otherwise be provided in a hospital setting historically. Within the area that we serve as a service is Lambeth and Southwark, and the two acute hospitals, King's and St Thomas's. Within that area, the practice population is 600,000, of which 45,000 are living with one or more chronic condition. Our service serves patients that are 18 or over, so we're not just the frail elderly, and actually in this area there is a lot of younger people living with COPD, for example, so the prevalence of chronic disease is quite high in this area.
Hello, my name is Anne Moger and I'm the Primary Care Nurse Lead in NHS England. As the Primary Care Nurse Lead, I'm particularly interested in the hospital at home service because I think it demonstrates huge opportunity for primary and community care nurses to work alongside their colleagues in secondary care, where there are different skill sets that are apparent. Adam talks about how he's developed as a practitioner in order to deliver the services that are required in the hospital at home service and how the nurse leadership has enabled him to do this.
So my name's Adam Fitzgerald. I'm a clinical nurse practitioner with Guy's and St Thomas's at home service. As a result of this service, from a personal perspective, I started within the service about 2.5 years ago as a band 5 nurse. I've progressed to a band 7 nurse through the educational opportunities and the support from the senior colleagues and other staff within the team. I've completed my advanced assessment course and I'm currently doing my advanced nurse practitioner training, which includes the prescriber course, which I'm hopefully starting soon. With regards to the service itself, I've seen it grow in acuity and the amount of patients that we see, and positive results from people in the community that now don't have to go into hospital and are more likely to seek out care.
Jose gives us a great example how through talent spotting from nurse leadership he was able to transition into a different clinical area using his transferable skills to develop both his own career and enable others to do the same.
The results that I've seen as a result of this survey is that there's really a big change in patient satisfaction. I'm leading on the evaluation and patient satisfaction. I've grown very much well. I'm new to the community. I'm an acute setting person, and I developed that autonomy, that knowledge, that skills, that competence and confidence to look after patients in their own home in a very acute phase. And of course, I have also developed that skills to work with staff of different varied skills, either community background or acute background, to work in this kind of service, which is kind of moving forward.
We spoke to Karen about what she feels about the 10 commitments and the importance in her service.
With regards to commitment 4, where we centred the individual's experience and high value. We work with the learning disabilities team, so these patients do not like going into hospital. They're out of their normal environment, they're out of where they've got all the equipment to help them. So again, they contacted me and said, oh look, one of our patients had a really good experience. Could we look at doing shared care so that they stay with that patient, so the therapists that are going into that patient do a joint visit with us.
When thinking about leading change adding value, it's important that nurses don't feel that they need to change the world. Small change at a local level is absolutely fine, and with the hospital at home service, it was clear that a population need was identified by a nursing team, and they've developed a service that's enabled them to keep patients in their own homes when they're acutely ill instead of admitting them to hospital.
I feel very privileged to have set up this service. I have previously, it's kind of in my DNA, that's what I like to do. I like innovation and I like driving change. And I think really the thing, it's just, you can never settle. You always have to think, right, what next?